Good morning and welcome to Need to Know Westford. I'm Kathy Ricketson.
And I'm Beth Morrison.
And we are here this morning with members of the Westford Health Department. So we're very happy to have you here this morning. We're here with Rae Dick and Gail Johnson. Good morning, Rae. Why don't you tell us a little bit about the Health Department?
Good morning. Thank you so much for having us today. It's a pleasure. So my name is Rae. As I mentioned, I've been with the Health Department for 18 years. Starting out as the health agent or health inspector with the department, and moving on to be the director of environmental services. I've been in this role as the health director for a little under 2 years now, just at post-pandemic of COVID, and I absolutely love the position. I love the community. We provide all kinds of programming for the community, always looking out for the healthcare and well-being of all of the residents and citizens here in Westford. Some of my credentials that you had mentioned, certified inspector for septic systems, background in community health and wellness. So
Thank
pleasure.
you. Thank you. Welcome. Welcome, Gail.
Hi, thanks for having me. I am a nurse of 31 years, and 9 of those years I've been at the Westford Health Department as a public health nurse. And I also provide many different educational programs and really try to get out in the community and do all of our immunizations for everybody during flu and COVID season, as we'll probably discuss in a little bit. Yes,
absolutely. Mm-hmm. As social workers, I mean, I just love public health and all of its services in the community. So I would love to know just more about the health department, what it does, and what residents need to know about it.
Sure. So the health department has quite a few employees. We do have an assistant director position. We have a public health nurse, health inspector, food inspector. We do also have a full-time admin who helps with the department. And through several grants, we have a regional community health and wellness coordinator, Brittany Nash, who has a background in social services. We also oversee what's called the Upper Merrimack Valley Medical Reserve Corps, and that is a group of 700 residents in the Region 3, Massachusetts, who help during emergency preparedness disasters. A couple other things is we do hire out we have 2 contracted hygienists for our school dental program. And we also have grants that pay for contracted positions such as our accreditation coordinator and a grant manager.
Wow.
So some of the things we do is we do lots of inspections on many topics, everything from beavers to kids camps to pools to housing, hoarding, you name it. We're all private septic here in Westford, so we have a lot of wells, inspections, installations. We're out every day soil testing and inspecting on folks' new septic systems when they go to sell their home. So those are just some of the things we do, enforcement pieces, permitting pieces. I would, we could go on forever on that.
Can you explain some of the important initiatives that you've undertaken this year?
Sure. So some of the things we are doing is we're updating some of our outdated regulations, if you will. For instance, our animal regulations have been on the books since 1972. So we just want to update those. We never want to over-regulate. It's just there are some protections for the environment, groundwater. We want to make sure they're in there. For instance, right now we inspect and permit horses and peccaries. Some of the other initiatives at the health department is we have a brand new community mental health and behavioral health committee, which we're really excited about. It's the first time we are coordinating. I've noticed over the years there's a lot of different silos, if you will. You have this organization or this group or the schools or recreation or the library, all working on different programs for mental and behavioral health. So one of my goals is to see everyone come together and work together and share resources to look at the needs of the community and how do we address that and get those resources out. So that is something we are really excited about. It's a very big committee right now, but I'm proud to say we have a nice representation both from the schools, we have the health department, we have our faith-based organizations. So that, like I said, that's one of lots of initiatives and programs that we put on each year.
That sounds amazing. And coordination is always so much more efficient and can really make it easier for people to access services and understand what they are, right?
Well, yeah, and I can imagine, I try to envision myself as if I was a resident in this community, where would I go for information? Where would I go when I'm in crisis? How do we get the information in one location, and so that people know where to go for resources, and that they know about how we can help them, so that's important.
And then that's just very supportive, people just feel when they come for those services.
So May is Mental Health Awareness Month, and I know you've mentioned that you're new committee for the mental health coordination, but I was wondering if you could talk more broadly about what other services you're offering for mental health, or events that you're hosting this month. I think I saw something for the Common on my way.
Yep, me too.
So today is the start of May is Mental Health Awareness Month, and so we are trying to get out as much information and resources to the public here in the Westford community. We do have an event on the Common today. It starts at 3 o'clock. We have a ceremony at 3:30 that will run about 25 minutes. But we'll have a table with resources. We're putting flags out for the whole first week of May, just so folks that are driving by, hopefully it will trigger a conversation to have and with their children or loved ones, and bring some awareness. We all have moments in our lives where we may have a mental health illness, or thoughts or concerns, or maybe need some assistance. So that is one event today. We will have Representative Senator Cronin today, Congresswoman Trahan. The Select Board has approved a mental health proclamation for this month, so they will also be presenting on that. And we do have our SANS program for suicide prevention, who will also be speaking. But on our webpage, we do have lots of resources and events that are taking place for the public on meditation sessions, yoga. We have a parent support group that's been started, and so I brought a whole bunch of flyers today. I know this is something people can't see, but they can find that information on a web page.
Okay. Can you talk, both of you, either one of you, could talk about, you do a lot of work through the schools, you do a lot of education programs. Can you talk a little bit about that, Gail?
I sure can. During COVID, I spent 7 days a week working nonstop, and I worked in collaboration with literally everybody, but these school nurses really were my partners. We worked every day talking about how to just work our way through and maneuver our way through this pandemic together, along with other entities as well. But the school nurses have been my biggest connection, and we work so closely with the superintendent of schools, the assistant superintendent of schools, and it's really quite a wonderful partnership that we have.
So now are you going back into the schools?
So now that the pandemic is sort of waning, we are still in collaboration together, but not as critical as it once was. But we partner with everybody. We partner with the librarians. We partner with police and fire, and the MRC that Rae was just talking about is my right-hand man. Really, without the MRC, I wouldn't be able to put on half of the programs that I put on without these volunteers.
And what can you say what the MRC is again?
So the Medical Reserve Corps.
Okay.
Upper Merrimack Valley. MRC, they're amazing volunteers. They're about 700, as Rae has just alluded to. Volunteers that help with emergency preparedness, but they also help when there isn't an emergency. They help with all my flu clinics, COVID clinics. When I'm doing CPR classes, I get volunteers to help me teach classes, stop the bleed classes, until help arrives. Oh my
gosh,
CPR.
these are
Oh,
great.
CPR, right. So CPR until help arrives. I have so many programs that require that extra hands, if you will. So the MRC is my biggest, that's my group. Those are my people.
That's fantastic.
Yes.
And who coordinates them in Westford? Is it?
So our coordinator is Nancy Burns, and then the health director oversees the MRC in our region. So as Gail alluded to, these are retired nurses. These are folks that might not be a doctor, have a medical background, social worker, someone that might just want to help out as an admin, but they help staff all of our clinics here in Westford. A lot of people don't realize these people volunteer their time at disasters. When we put on warming shelters, cooling shelters, these are the folks that come in and hold your hand and give you a glass of water and, help you through. So we really appreciate all our volunteers here in Westford.
Just that one-on-one support.
Absolutely.
That really gets you through an emergency, right?
Yep.
They're amazing.
I love the titles of these programs. Can you say a little bit more about them?
So I do so many things, but one of the things I'm very, very proud of is the chair of the Westford Coalition for Nonviolence, WCNV, the acronym. This is a coalition that was brought together about 13 or so years ago from 2 domestic violence incidents that happened in this town. And at that time, the town manager brought all the stakeholders together and kind of formed a coalition to see what we could do to, prevent this from occurring ever again. And then the health director previously had it, and then I took over as the chair. And although now at this point it's a smaller coalition, however, we partner with many people, the schools, the Neshoba Tech, and the academy, in addition to residents, victims, and other town employees are part of this coalition. And we have just updated, one of our retired members just updated our handbook, which I'm pointing
Which
to,
you're
but no one can
holding,
see it.
right.
I know it's a podcast, but it is something that we're very proud of. We really updated this to add more resources in it. This booklet is online on our website, but it's also, if you just plugged into Google WCNV or the Westford Coalition for Nonviolence, you would get this. All the resources are on this website in addition to this booklet that you can look at. Some people cannot have this booklet around for being in danger having this, so you can just get on this website and then get out of it very quickly for safety. But this booklet really is, it's at the police station, at the town hall, it's at the senior center, it's at the library. It's really just filled with definitions of what domestic violence is. Physical, sexual, emotional, psychological, verbal, financial, spiritual abuse. Definitions, but also resources. And then some information on legal, how to get a restraining order and things like that. This is not, this is just a resource book.
Right.
But it's been updated just recently, so I'm very happy about that.
And it sounds like there's just so much information for not only people who maybe are in a tough situation, but their families, our teens, others who are, maybe dealing with things that are very difficult. So it's there, it's available, it's online, it's all over town, so you can access it many different ways.
Well, when you're talking about, when Rae was just discussing about the mental health, but mental health, domestic violence, alcoholism, substance use, it's all one umbrella. Really, it's all kind of together. As Rae was just mentioning, sometimes every other place does different programs, but we're trying to kind of verge them together. They build on each other. Mm-hmm.
And when they're well coordinated, people can really find the help. And sometimes you need help from a few entities. And as we know from medicine, it's really great when they're coordinated, and it's much tougher if they're not.
Yes. So I know you did a ton of work during the pandemic, and
You said it.
You just have my same sigh.
yes. I feel like we've just come through. in some ways it seems like a lifetime ago, and then other ways it feels like it was just yesterday. So I'm wondering if you can, now that the COVID emergency is ending, if that's changing any of the services or things that, were available, like the testing or the reporting or the how it affects the vaccine. So I wonder if you could talk about the end of the COVID emergency.
Yeah, so, for us, although it's very different, we're in post-pandemic, for our department, we are still having regular meetings with the state on the constant changes of what does the fall look like, how will we give out the COVID vaccine. That is constantly changing between the FDA and the CDC and our Massachusetts Department of Public Health. So we are on regular meetings with that. As many people may or may not be aware, free COVID rapid kits will not be available under your insurance per the government after May 11th. The health department does have kits that are available for free for any resident that are at the library,
Excellent.
senior center. We just gave out a whole bunch at town meeting. We generally, we've been giving them a farmer's market everywhere you can think of. We'll even have some today, actually, on the Commons. So we do have some available. But besides COVID kits, and I would say the vaccine, we're constantly looking at there's always a new strain. We're watching Europe. We're watching how other countries are dealing with that. And besides COVID, we do also look over, and I'm sure Gail will go on to this, about communicable disease. There's all kinds of diseases that are reported to our office every day for residents. We're looking at tick-borne illness is a very big concern here in Westford. But I'm sure Gail can go on more on communicable. But with COVID, although for many people they've been over it, mentally, for our department, it's still very prominent in our office. It's given us a lot more room where we've been able to move into this mental health group. We've also, we're working on opioid task force settlement funding and plans that we have for the community with that, so.
Wow, let's talk about those communicable diseases.
So-
It's been even more than COVID, right?
So one of the primary position in public health nursing, all public health nurses in 351 cities and towns share a database with the state of Massachusetts. And I only see what's happening in Westford. Every public health nurse in their community only sees their communities. And 97 plus communicable diseases are in the United States. And my job is to make sure that when I go into this database that I share with the state, that I am immediately checking and then presenting, really working on these cases. They're called cases. And so there are 97 of them. So I am monitoring any communicable disease that happens to hit in Westford.
And how does it get reported to you?
So when you go to a doctor, and whatever is wrong with you, you have all these symptoms, the doctor says, well, I don't know, so go to the lab and get a stool specimen, a sputum specimen, a nasal swab, a throat culture, a urine, whatever it is. The doctor says, go to the lab and get that done. The lab, by law, is responsible to report anything that's considered a communicable disease, that means spread from person to person. So the lab then reports it to the state, and because the state epidemiologist cannot call the millions of people that live in Massachusetts, so public health nurses are tasked with taking that information that gets put into this database that we share, and then we start working on these particular cases. In other words, so if someone came in with salmonella, it means into the computer with a diagnosis, for an example, of salmonella, I would immediately start working on this foodborne illness. If this was tuberculosis or tick-borne disease, now although tick-borne diseases are not communicable, but the state does collect the data from there. And just to talk about COVID for a second, at the beginning, before we had these COVID tests, we had all those tests, those PCR tests that were done at urgent cares, at the doctor's offices, all went to the state, and they collected that data. But then when we had those test kits come and you could do it at home, that data was no longer collected by the state any longer. So there are still collection of information if you do go to a doctor or you do go to the urgent care and you get, or the emergency room, and you get the PCR test, it still gets reported to the state. But all the other tests, all those antigen tests that are at home do not get reported. So the data is no longer as prevalent
As accurate
as
it might
it's
have
not.
been.
So when people call me and ask, well, how many cases? There is no way of knowing that.
So we
I'll
don't
know
know
a
if
little
we're
bit.
having an actual outbreak in Westford.
Not at the, no,
Correct.
Okay.
no, because the
That's
data
So
is
we
no
no longer
longer.
post it.
Correct. There's no, because if you go onto this database, it might say 30 people. Well, we know there's not just probably 30 people, but that is who went for a PCR test. So that is what we see.
That is really interesting. I just had a friend go to Northampton, and when she got there, she noticed everyone's wearing masks, and she was surprised. And it turned out they were having an outbreak in the town. So, so I don't know how they communicated that, but it clearly was communicated to
Well, you
the
can
staff.
find, well, I guess you can consider small places like in, an example, like nursing homes. You would know if there was a cluster event in there.
Okay.
Cluster is 2 or more. And so if there is that, they would know that, right? So the people who work at the nursing home would see that. Same with daycare centers. Schools, if you see that that's happening, or in sports, you would also see that a bunch of kids are out for a particular, maybe COVID, maybe something else.
We've heard a lot about RSV. Is that communicable?
It's not actually put into the state database. I'm not saying you can't, be concerned about that, but it's not a communicable in outbreaks, if you will.
Okay.
One thing that I've been watching with COVID is the wastewater testing that we don't have here because it's all septic, but you can kind of see, the Boston wastewater, you can kind of see the spikes. And I figure if it's spiking there, it's probably going to be spiking other places as well. So I'm glad that we have that testing, although it's kind of after the fact, isn't it? It's a little delayed in picking up those cases. So it's, not foolproof, but gives us a little bit of an indication at least. So are they going to continue these testing and reporting for COVID after the COVID emergency ends, or
The wastewater
or not?
testing?
For the wastewater testing?
Yeah,
They're
and
gonna
for
continue.
in Massachusetts, just in general, like you were saying, if you are tested, is that still going to be reported, or is that going to end with the COVID emergency?
Have to tell you, the Mass Department of Public Health has
They
not
haven't reported?
indicated, honestly, the complete end of anything. That we're transitioning. So there are certain things that will end, and there are certain things will continue. Isolation and quarantine has not changed. It is still 5 days after you, so if you tested today with COVID, today is day 0, tomorrow starts day 1, and you would go full 5 days. And then on day 6 through 10, you can wear a mask and continue with your life. But none of that's changed. Quarantine has changed. In other words, you don't have to stay home anymore. You just watch really for symptoms. But all the mitigation strategies still continue. I mean, if you're in a big crowded room and you want to wear a mask, wear a mask. If you feel uncomfortable in the winter or fall or winter months, you have a choice. You can wear a mask, don't wear a mask. These are now up to us to make decisions. It's no longer mandates. So that's where we're at right now.
It's good information to have.
Can you talk then a little bit about the vaccines? Because obviously people got so much help getting the vaccines, and what is the situation now?
So right now, Gail and I are planning for the fall and looking at not only we give the influenza or flu vaccine every fall, we give it out to about 1,200 residents. That includes men, women, and children, families. And so as we look at the COVID vaccine, we are on, every other week we're on a call with our state epidemiologist who represents all of Massachusetts with the Department of Public Health. And so right now we are still waiting for information of how that looks, the vaccine itself. So when you think about like a flu vaccine runs anywhere between $20 and $60. The COVID vaccine is running about $125 to $150 a shot. So how do health departments pay for that up front? In the hopes that if you have insurance, that will be reimbursed for that. So those are some things that I think the state is still trying to iron out. I know the bivalent vaccine, the booster, is supposed to come out for the fall, but again, we're still waiting for information on what that looks like. And I think they're trying to make it a little easier. It's been so complicated, oh, I just had this vaccine 2 months ago. When do I need And so I think they're trying to get the education out a little easier for people to understand. So for instance, if you had a booster maybe in January, when do you do again? So we're kind of waiting for what that's going to look like. I think they're still trying to iron out all that information with insurance companies and how that's going to look.
So you also give out the influenza vaccine and the pneumonia vaccine?
We don't give out the pneumonia vaccine at this time. We do actually, we're offering right now the Shingrix or shingles vaccine. We have received some grant funding, and we have some revolving account funding that we're able to provide that to folks. That is an expensive vaccine that you do need two inoculations. Correct. And so we encourage anyone who is interested to contact the health department, and Gail's happy to provide that.
And you do that in clinics, or people come to you?
In this case, we do it in small groups because we have to keep track of each person and each inoculation that they have. So Gail has appointment only. Gail, I don't.
For Shingrix, yeah.
For Shingrix.
During the fall, winter months, when I do the flu, I use a software called Color, and it comes along with a link, and then I would put the link out for the public, and then they can click the link and make an appointment, putting all their insurance information in there, etc. And I have to start working this summer back on scheduling and preparing for flu. That's a big undertaking, and so usually I like to do all my clinics in October. It's better to do it later in the season than too early, because just like COVID, there's a waning period for flu, so we want to really make sure that the later you get the flu vaccine, the better that would cover you through the flu influenza months. So October is a good time to go get it.
Well, you certainly have a lot of ground to cover. Westford's a big town. It has a lot of different communities, little different parts to it, diverse communities within Westford, different languages that are spoken here. How do you handle all that?
So as you can see, our public health nurse is one. So again, just to reiterate with our, when it comes to any clinic that we put on, you have to make sure the volunteers are educated and up to date on cultural backgrounds, languages, all the paperwork, information, authorizations they have to sign. The state, as Gail mentioned, came out with a brand new software called Color, in which case, it's educating, for instance, our senior population on how to use that software and how do we provide assistance. For instance, not to go back to COVID, but one of the things that's been our concern is folks that were on Medicare and Medicaid may get dropped because they signed up during the COVID pandemic, and so come May 11th, they'll be dropped. So how do we work with our social services department, with Allison Christopher at Senior Center? We work with her on a lot of projects, hoarding, inspection, all kinds of things that require social services. So, that's something that we have been working on.
And residents can access computers at the library and the senior center.
Correct.
The senior center has been absolutely amazing. They actually made a video when this first started. This was a few years ago. They actually did a whole how-to walk through the whole color process for the seniors, and they would actually book appointments for them while they were on the phone. They have been instrumental, honestly. They've been so great.
We do have a great senior center.
Oh, I love them.
We do. And we had Allison
Well
on.
loved in Westford.
they are well
So
loved.
well loved, and we had Allison on as our very first guest because a lot of people didn't even know the full scope of her responsibilities as town social worker.
Right, and I think a lot of people think just because she works at the senior center that it's only for seniors, and it's not. And so, we're so fortunate to have that department.
So I have another question. So we have an elected Board of Health, so I'm wondering how that interacts with your department.
So we have an elected Board of Health of 5 members. We meet once a month. They always meet the second Monday of the month at 6 o'clock right now virtually. And so we interact with them on all kinds of projects through email, phone conversations. And then, as I said, any resident that has something they want to bring to open forum or they'd like something on the agenda, that's something that's presented at the meeting. But they look at things, all kinds of, as you know, public health covers a variety, whether it's environmental health or medical or trying to just think of some of the enforcement pieces. There's always something going on, and I think that's what I love most about the job is just when you think you have a handle of public health or what's, something new comes that we never even anticipated and keeps it interesting.
So they really set the policy, right? Some of the policy for the department?
They do. They set the policy. They oversee the health department, and they. I'm trying to think. I'm drawing a blank. I don't know.
Well, I know some of the environmental policies, like the styrofoam ban and the plastic bag ban. I think
that was a resident
came through a residential request, but I think they worked with the Board of Health, right, to create the policy, and then they went to town meeting to have the voters approve it.
Mm-hmm.
So I think there's like citizen initiatives that can come through.
Absolutely.
The Board of Health.
So we have had citizen initiatives where we actually reach out to the citizens. And we worked with a couple of citizens on the polystyrene and plastic bag initiative. And that, of course, once working with the health department staff, that is something we do bring in front of the Board of Health just to present. But initially, it's the town that votes on it at town meeting, the residents that voted that in. So our piece is the enforcement piece to follow through, if you will, with the citizens' request.
So that's so good to know. Citizens can bring concerns before the Board of Health.
Absolutely.
They have an open forum for any
We
town
encourage
resident
ideas.
to come.
Yep. Yep.
They can bring their ideas, and then policy can be set, and you can then carry out these
Correct.
policies. So people can see how it all works, and how it all works together is really, really important. So is there anything else Westford residents need to know about the health department?
I don't know what Gail has, but, I would just say that we have lots of programming. We have, for instance, just one example, we have a senior dental program where folks that don't have insurance here, we have a contract with some licensed dentists here where we could provide services and cover free cleanings and fillings, things of that nature. But that's just one of, I would say, hundreds of programs that we provide. So I would say to certainly look to our website. We do put out a lot of information weekly on our social media Facebook page. And also we do have a community health and wellness department. So they too, we coordinate with them, and they put up a lot of information on these programs. So.
And can you tell us what your website is?
Sure. So the website is www.westford.gov, and they can just search under the health department. And
Is it westfordma.gov?
Excuse me, westfordma.gov.
Yes,
I
MA.gov,
apologize. And our phone number for the health department is 978-692-5509.
And if anyone wants to volunteer for the Reserve Corps, how would you get involved in that?
So right on our webpage is we have a link to the Upper Merrimack Valley volunteer registry list, and so they can click on that, and there'll be an application there, and they can call the health department, and we can send them the information and coordinate them with Nancy.
Mm-hmm.
Is there anything else you'd like to add?
Well, I was just going to offer some of the educational things that I do throughout the year. I teach basic life support, CPR classes, first aid classes, stop the bleed classes, which really teaches how to identify life-threatening bleeding with, pressure, packing, and tourniquet use until help arrives. Stop the bleed is sort of embedded into this program, but also teaches other skills as well. I do
it's an
blood
intriguing title, until help arrives. So you're waiting for
so
an
basically
ambulance,
you're
or?
it until
Yes.
help arrives.
Okay.
You're it. So something
What you need
terrible
to do.
happens, and you are the one right there.
So it'd be like basic first aid.
It's really just how to identify life-threatening skills and then what you do to help them. What other things? I do blood pressure clinics once a month at the senior center. We have hearing, actually. Dr. Megan Ford from Hair Smart Audiology, she's in Littleton, actually has been coming for years. Every second Monday of every month. For years and years, she has provided hearing checks.
Voluntarily.
Really, at the senior center. You just have to call the health department and book the appointment. It's every 15 minutes. It's not a full audiology checkup, but it does like hearing checks or earwax checks or whatever. She's amazing. Really has volunteered for years to come to the senior center. She's great. What are other things that I do? There's so many things I do besides disease surveillance, besides chairing the committee, camp inspections. Oh, I don't know. There's too many things.
Well,
But-
one thing I would just add is that, unlike other health departments, Gail and I both sit on state organizations. Myself, I'm the president of the Massachusetts Health Officers Association. So that is an organization, nonprofit, that oversees 600 plus health directors, health inspectors, and public health nurses. It's important, and I'm sure Gail will speak to what she sits on, but I just want to share that because we're not only, our focus is not only the Westford and this community, but we want to make sure that we're providing good public health and initiatives that are statewide. And we're able to bring that back, which is great. We're the first to hear about grant opportunities. So that's been really important. And this year we're working on accreditation for our health department. We want to make sure we're supplying the best standard of public health initiatives. So I just wanted to add that as the last
actually,
piece.
thank you for bringing that up because I'm the president also of the Massachusetts Association of Public Health Nurses for 351 cities and towns of Massachusetts. So that's a very...
We have star power here.
We love it. We were passionate about it, so it's important to us.
I think it's a unique thing in Massachusetts. I don't know if it's a New England thing, but because I didn't grow up here, so everything in my home state of Illinois is county-based, and here everything is town-based. And so there's a little more effort has to go into coordination because every town is kind of doing their own thing. So it is really important to have that coordination with your region and the state, so that you kind of know what's happening across the whole region, because people pass through Westford who don't live here, and they use our services as well. So it's important to know what we're all doing as a state and as a county and as a region to work together. I just had one other question. I know speaking about substance abuse, Narcan is now available at the counter at the pharmacy now, right? You don't need a prescription or to be a special. I know previously the EMTs would have it on the trucks and stuff, but now you can just, if you want to keep it yourself and, if you're going about your day and, happen to see something, you can take action. So I wondered if there was any training about how to use Narcan.
Yes. So for Westford, we are a licensed distributor of Narcan. We had to apply for that initiative. We also provide Narcan training to, for instance, we just provided it to all the library staff. So we provide that to any employee or any resident that would like that. We can certainly keep it anonymous. We can supply not only the Narcan training, but we're working with our police and fire department right now to give out kits. So if they're in the field and there's any resident or family member that may have an issue or repeat an issue, they can give these kits so that family will also have that in their home. The second initiative is, which we are still working on and has not rolled out yet, is what's called Sandbox Initiative, the Good Samaritan Law, meaning the SAM part, the box meaning the Loxodone box. And so we are hoping to roll that out to any business here in Westford who would like a box put in their establishment with the Narcan and provide training. We're going to start on the 495 corridor first here in the community, and hope to see that grow. But we do provide youth mental first aid with opioid settlement funds and all kinds of other programming for prevention. That's what we're in the line of, public health prevention. So we're trying to help families when it comes to harm reduction, substance abuse, things of that nature. And that's something that the Community Behavioral and Mental Health Committee is starting to work on. So I hope that answers
Such
that.
an important initiative,
It
to
is.
keep people alive, really prevent the overdose and keep them alive so they can get into treatment and get the help
Right.
that they need.
There have been many news stories lately about people who have been saved even by a teenager I saw on the news who was trained at school by, I think, the public health nurse, so
Yeah,
saved her
we're-
neighbor. So
It's
a very important
I really
initiative.
think first of all, not just Ray and I, but our whole department. We're advocates. We're advocates for town staff, town employees, all the community residents, and then all of Massachusetts. We will go back to, but we're state organizations. We are really a voice for me, for the nurses, and really bringing back and trying to bring back the best to our town and our communities. All of these things we're talking about, the opioids, Narcan, mental health, domestic violence, all falls under this, as I mentioned earlier, this umbrella. And we are really trying to push out as much educational, promotional information to everybody. I also was thinking while I was sitting here listening to all of the things we do, but if any resident has any suggestions on what they would like us to offer, please feel free to reach out to the health department and say, I would love if you did such and such. I would love to hear more about this or that. And I think it's important to, I love teaching, just so everyone's aware. I absolutely love it. It's one of my favorite things. I also am a nursing instructor at Middlesex Community College for my nursing students. So I love everything about teaching and education. So if there's anything that anyone has a topic of information, please reach out and say, you know what, can you put on something? I'd be happy to work with Ray and anyone in our department for that.
Oh, that is
And I also
fantastic.
think the department has been great combating misinformation because we've seen this just surge of misinformation and anti-vaccination coming out of COVID and during COVID, and with the whole mandates, and people were arguing about masks, and I think it's kind of died down some, but it's still percolating out there. But I really appreciate that the health department has been very clear in your messaging and very, just to combat, and you're tied into all the state initiatives, so you can use that information to push out to the community to really fight that misinformation that's out there. So thank you for that.
No, and we appreciate you inviting us today. Because one of our biggest challenges is communication to the public. Someone might say, oh, you don't put in anything for nutrition. Well, 3 weeks ago we had a big, so how do we get that information out to the public, and whether it's social media or events here in town that we go to. So we appreciate this opportunity.
Well, thank you so much for coming. We so appreciate everything that you're doing. We're so lucky to have you here in Westford, both of you and your whole department. So on behalf of the residents of Westford, we just say thank you, and we hope everyone will now know more and will get involved in some of the initiatives. And good luck with your event today with Congresswoman Lori Trahan and Senator John Cronin, and look forward to that later on today on the Town Common.
Great. Thank you so much. We appreciate it.
Thanks for coming.
Thank you.